Day. Cheers. Happy Mother's Day weekend. And joining me, we have Dr. Bruce Nelson. Cheers to the Pat McMahon Show. Thank you so much for coming in.
Well, thank you for inviting me.
And do you think I scared everybody when I...
That is pretty scary.
You thought it was a candy cane.
I thought it was a candy cane, yes.
No, but I have nightmares about this at night. You know, if I know I've got to go in and get my teeth cleaned and my gum scraped, I'm just, you know, very scared about that. But, you know, I love what you say. We can't recover from what we don't treat. And I think that is so important. I'm looking at your smile. You have gorgeous
well,
teeth.
Thank you.
My parents paid a lot of money for this smile.
Oh, that's good. Looks good.
And the last time I went to the doctor, though, I was surprised, I have to admit, because I do floss, I do brush, but they said I had deep pockets.
Yes.
And can you explain what pockets are and what why that is a sign that something is wrong and needs to be treated in your mouth?
Okay, well, any kind of gum disease is a bacterial infection. Bacteria, if they get a chance to get established, will irritate the tissues, and eventually you'll start to lose the tissue attachment around the neck of the tooth. And that's when we could call it a pocket. Mm-hmm. It's the little cuff of tissue that goes around the neck of the tissue, around the neck of the tooth. And as it gets deeper, that's what we're measuring, and that's an indication of the disease process starting. So when the gum pocket gets too deep, then you start to lose the bone around the tooth. That's what we call periodontal disease. And eventually, if that proceeds too far, you end up losing your teeth. Which we obviously don't want you to do.
No. Since I do TV, that's not good.
No.
I don't want to lose my tooth.
No.
So there's bacteria right now having a party in my mouth, in my gums.
There's always millions of bacteria in your mouth. They're always there. The trick is to keep the bacteria under control. And that's why we always tell you to brush and to floss. You know,
well, we mentioned today that I was thinking of what a great, awesome gift it is to, it's something moms usually don't take care of themselves. They're always worried about their children, getting them braces or getting them tennis shoes. But what an awesome thing for some father out there, right?
Absolutely.
Or to set up an appointment for their mom to have teeth cleaning. And, your information said that 80% of people have some form of gum disease. And how many of that would be women?
Well, obviously, the population's about 50% women, so 50% of your 80% of the Americans that have gum disease would be women.
So this would be something that would be a mother would appreciate getting to go have done. Because didn't you say that so goes the mouth, goes the rest of the body?
Absolutely.
Right. And if you have an infection, that could get in your bloodstream.
Oh, absolutely.
What other things can that lead to in effect?
Well, there's a lot of research now that's showing that the bacteria in your mouth do get into the bloodstream, and there's an increased incidence of heart disease, stroke, worsening of the symptoms of diabetes. Pregnant women that have gum disease show a tendency to have preterm low birth weight babies.
So this isn't just about a smile. This is about your whole body.
Absolutely. Yeah, it's your whole body that's involved. The bacteria that are in your mouth, if you have a lot of bacteria, they've shown that they inhale them. There's a greater chance of people with respiratory infections that have gum disease. So there's a lot of things that affect your systemic, your overall body health.
Right, and that makes sense. Let's take the mystery out of the procedure, because I think a lot of people think of this, and it's not this.
No.
It's not the old gum scraping, and before, when you would do the surgery, it was like cutting and stitches.
Right.
So what's going on here?
Okay. At Ameridontics, what we do is we do a procedure called LANAP, which is a laser-assisted new attachment procedure. We're actually using a laser to go in around the neck of the tooth where the bacteria are building up on the root surface of the tooth, and we're cleaning out and sterilizing that pocket with a laser. And instead of cutting the gum tissues and suturing them back together, which is the old technique, we're using this small fiber optic on the laser, which is about the size of 3 hairs, and we're just introducing that in around the neck of the tooth. And it sterilizes the pocket, cleans out the diseased tissue selectively. It doesn't randomly cut it out like it would with a scalpel. So it's a really nice procedure. The healing time is much faster. There's virtually no discomfort. People go back to work right afterwards. It's totally different than people's concepts in the past of treating gum disease with the scalpel and the surgery that goes along with the old technique.
And you know, ignoring the problem. This is not one of those things. Ignorance is bliss. It's
No,
not going to go away.
no.
Correct.
Well,
It's
your
just-
teeth will go away if you ignore it too long.
And it will not only will you lose teeth, but like you said, the bacterial infection getting into your bloodstream
Right.
and affecting, you know, people that have diabetes
Right.
or heart disease. Have they ever stopped to think that maybe this is caused by the periodontal disease?
We have a lot of people that after they get the gum disease treated, we mark on how much better they feel. And people with diabetes that have had symptoms and they've been having a hard time controlling it, a lot of the times, not always, but a lot of the times they will say that it's easier for them to control their diabetes. And you know, we're just happy to be helping people get better health overall.
And you know, technology is an incredible thing, and the fact that you and this group have stayed on top of that and are committed to that excellence of learning new techniques and offering that to your clients and potential clients. And you know, so what are the signs? Like if I'm flossing and my gums are bleeding, or
If you have red, puffy gums that bleed when you floss or brush, that's usually an indication of gingivitis, a beginning sign of gum disease. A lot of the times as the gum disease progresses, you may actually notice a decrease in those symptoms, but you know, oftentimes bad breath goes along with it, and then obviously as you start to lose the bone, the teeth start to feel loose, or you'll start to notice, some people notice that their front teeth are drifting out, that they're starting to get spaces between their front teeth they didn't have. That's usually related to the fact they're losing the bone around those teeth, and the teeth are starting to drift.
And so it's not too late. People need to call you. And I love your phone number, that is 888-FIT-GUMS.
Thank you.
Isn't that perfect? That your teeth are going to fit in your gums.
Right.
I love that. So it's not too late.
No.
I noticed in the brochure that you have and on your website where the gum actually starts growing back to the tooth after the procedure and after you get that lime deposit, right, scraped
The
away.
tartar deposit off the tooth.
So if it's not too far gone, eventually there can be reconstruction with
Well,
the
this
gums
procedure is really remarkable because the latest study that just came out indicates that you actually do get a new root surface forming, you get new attachment of the tissue to the root surface, and you actually are regenerating bone in a lot of cases, which is something that's been unheard of in the past.
Right.
And so we see a lot of people that have, in the past I would have said they were going to lose their teeth,
Right.
and with the full treatment they end up being able to keep their teeth, and it's a remarkable thing to make people that happy. They come in thinking they're going to lose their teeth, and we're able to say, no, you know, we can save them for you.
So you need to contact today Dr. Nelson to find out more information. What's your website where people can find out more information?
It's Ameridontics.com, and we have a number of dentists here in the Valley that belong to Ameridontics, and we're all trained and licensed in the procedure, which is an FDA-approved procedure.
Thank you so much for being here today, Dr.
Well,
Chris
thank you.
Nelson, and for helping us to know that it doesn't have to be like this
Really.
anymore. So you want to give them a call, 888-FIT-GUMS. Stick around. It's a Mother Day celebration. Opportunities for working stay-at-home moms next on the Pat McMahon Show.